Those numbers are astonishing. 28% of young girls nationally?
Yes, I need to correct that. I've been spending the whole of yesterday trying to correct it. It's not nationally.
Okay.
It was a specific study done in some, not really a study, HIV counseling and testing done in Natal Midlands, in a few schools in that area. Natal Midlands is one of the highest prevalence areas of HIV and AIDS, by the way. So I was in Mpumalanga and Khartsibande, which now is #1 region. Khartsibande is #1 in terms of HIV/AIDS prevalence, because we want to go and launch the biggest HIV counseling and testing. So I was given these figures. Now, it's not a national figure, I want to emphasize that. It's in that particular setting in Natal Midlands. We don't have a national figure of how many schoolgirls are HIV positive in South Africa.
So this 28% speaks to that Natal particular area, where that study was
those
done.
Particular schools in that particular area.
Okay.
It wasn't actually.
It doesn't even speak to the province of KwaZulu-Natal.
Not at all.
Okay.
Not at all. It's in that particular city where they were doing HIV counseling and testing. But it's begging this.
So as the numbers stand, we don't know what's the national picture.
No, not at all. Such a study was not done. Scientists haven't told me, at least.
Okay. Let's take a look at the graphs that you brought for us. Let's take a look at this particular one. What does this tell us?
This tells us a very disturbing story.
Right.
As you can see, it was done in 1990.
Okay.
But in 2005, another study was done. It shows the same thing.
Okay.
And in 2012 by UNAIDS.
All right.
What it shows is that from 0 right up to 10 to 14-year-old, between girls and boys, the red one are girls, the blue one are boys. They are the same. But immediately after the age of 14, in terms of HIV positive, the girls start shooting up.
Okay.
The boys remains very low.
Does this mean young girls become sexually active at an early age in South Africa?
It simply means young girls are having sex with older men, not these boys.
Yeah.
Because these boys only start shooting up, as you can see, between the ages of 25 and 29.
Right.
It's only then the boys come up.
Yeah.
But throughout that period, they remain low. So who is sleeping with these young girls?
Yeah.
And we believe this is the sugar daddy syndrome that is destroying not only South Africa, but the whole sub-Saharan Africa.
Does this mean, is this a national representation?
Oh, yes.
Okay.
This one is
This is not just KwaZulu-Natal Midlands.
No,
it speaks to
it's national, but
national.
if you look at this one from UNAIDS,
right,
you see that is the whole sub-Saharan Africa.
Okay.
The red are young women between the age of 15 and 24.
Okay.
The blue are young men between the same ages. This was between 2008 2011, as you can see. Look at South Africa. These are young women between 15 and 24. These are young men of the same age. This is Botswana. This is Lesotho. This is
So this Zambia. Is a picture that cuts across the sub-Saharan region.
Cuts across sub-Saharan region, and it's very disturbing.
So what does it tell us? It tells us young girls between 14 and 24 are most vulnerable. Is this just simply socio-economic? Sugar daddies take advantage of that?
I think so. I think it's socio-economic, yes. You have got the young girls who are mostly orphans. I mean, you have got 1.3 million orphans in South Africa. Mostly are maternal orphans, girls who have got no mothers. It's very easy to lure them into financial transactions because they've got no money. They need, they need support, they need airtime, they need phones, they need to do their hair, they need to do all sorts of things, and they become vulnerable to men who branded money around who are working. These boys are not yet working, and I think it's a big socio-economic problem in this region.
What do we do? What's the plan from a Department of Health perspective?
Firstly, in KZN, the MEC for Health, Dr. Sibongiseni Dhlomo, has launched an anti-sugar daddy campaign to make communities aware. But you are aware that in our school health program, which President Jacob Zuma launched in Cullinan in October, we said one of the most important programs at school, which must be done by the Department of Health, especially in the NHI pilot projects to start with, is reproductive health and rights. That's what we need to do. But furthermore, in April, we're going to launch a huge family planning campaign in the country under the theme dual protection. Because United Nations Population Development tell us that the problem in sub-Saharan Africa, because by the way, these things I've shown on the graph, it's not only HIV/AIDS, it goes hand in glove with the figures of pregnancy. Have you seen them? Those ones are national. 94,000 schoolgirls.
Yes, these ones we talk
those
about
are national. The one that was wrong is the 28%, but the others are correct, and they are national. Now, they say the reason that it happened In the 90s, when HIV/AIDS started biting, in the 90s, Sub-Saharan Africa preached 3 things, you know them. Abstain,
yes,
be faithful, condomize. During that era, Sub-Saharan Africa inadvertently threw family planning out of the window. Because if you remember when you were young, you used to have family planning nurses.
Yes.
Family planning campaigns, family planning clinics.
So is this a new campaign now too?
We're going to launch it in April. We have to.
But what is the campaign that is targeted at young girls between 14 and 24 to empower them to make the right decisions? Yes, there's somebody offering you money, but you can say no because of the risks that are inherent in this relationship.
If I had time, I'll outline to you. We do have a document about the school health campaign.
Yeah.
What must happen?
Yeah.
We are not people. The problem with us South Africans, we get very excitable when these things are mentioned. When we launched the school health campaign, all the papers were obsessed about condoms
Yes.
at schools. That whole campaign is about reproductive health and rights.
Yeah.
If you look at it, we teach about puberty, sexuality, because the other thing that has happened, which society is not aware of, during mine and your time, Vuyo, young girls used to menstruate at the age of 16, 17, 18.
Has it changed now?
Absolutely.
Yeah.
They start at 10.
At 10?
Yes. They start at 10.
What has happened?
Diet.
Okay.
Diet. You know, I talk always about diet. Our diet has changed.
Yes.
Completely. So they start at 10 and they can start falling pregnant at
From that age.
And getting HIV positive from that age.
But Minister, I do think, because we've run out of time now, we do need to have a conversation though about what is the campaign that we are undertaking to target the 14 to 24-year-old young girls? Because if these are the young girls who are vulnerable, as part of our strategic intervention, there must be a clear effort to help them make the right
where
decisions.
Are these girls? They're at school.
Yes.
So you can't target them anywhere else except at school. That's why the school health program has to become so important for South Africa.
Yeah.
That's why I was hurt when some papers made jokes about condoms at schools. Minister want to give condoms, leaving the broader picture away. That's why you don't even know about it. It's as if these things are new.
Yeah.
They are waking up to get excited about them. It's not new.
Let's take a break.
New.
Thanks,
Yes.
Minister, for coming in. Let's just show you that graph again. So that's what the picture looks like.
Yes. The red is girls, blue, boys. Up to age of 10, they are together, between 10 and 14. From 14, the young girls start shooting up. The boys remain slow. The boys only start getting high at 25 to 29 years.
Okay.
This interval here is the most dangerous one for Sub-Saharan Africa.
Thank you very much.
That's why you must target them at schools.
Thank you very much. Minister Aaron Motsoaledi is Minister responsible for health. If you'd like to talk to us here on Morning Live, tweet at Mbuli Vuyo, text 33726.